Welcome to this explainer. Today, we're diving right into the data to see exactly how the recovery timeline for modern endoscopic spine surgery stacks up against the traditional open approach. The stakes for your mobility and your daily life are incredibly high, so let's see what the numbers actually reveal. Here is our roadmap for today. We'll start with the herniated disc problem, move on to traditional open surgery versus the endoscopic approach, and then we'll compare recovery timelines before wrapping up with getting you back to an active life. Let's get right into it. Look, if you're dealing with severe lower back and radiating leg pain, the surgery itself usually isn't your biggest fear, right? It's the downtime. The thought of being laid up for months on end is absolutely terrifying. But what if it didn't have to be that way? The clinical data actually tells a completely different story depending on the exact procedure you choose. Part 1. The herniated disc problem. To really get why this matters, we have to look at the spine itself. It's this incredibly complex balancing act of vertebrae, shock-absorbing discs, and super delicate nerve roots extending outward. When it's working, it's a marvel of biological engineering. But all that complexity makes it highly vulnerable. So when degenerative disc disease hits, one of those discs can actually herniate and pinch a nerve root, and that compression is exactly what triggers that agonizing, radiating leg pain. It is a mechanical, structural problem, which means it demands a physical fix. Which brings us to Part 2, traditional open spine surgery, and Part 3, the endoscopic approach. How your surgeon fixes this herniation literally changes your entire recovery journey. With traditional open surgery, they have to use a massive retractor to pull back thick layers of muscle and tissue just to expose the spine. It's a very large incision. But the endoscopic approach? Totally different ballgame. The surgeon works through a slender little tube that houses a high-def camera. The incision is just 8 to 10 millimeters. That is less than half an inch. Now for Part 4. Comparing recovery timelines. Because that endoscopic method leaves your muscles and tissues largely intact, the healing timeline shifts radically. We're talking night and day here. Open surgery usually means a hospital stay, general anesthesia, and heavy healing from the muscle damage. Endoscopic surgery, though? It's an outpatient procedure. You're usually just getting local anesthesia and some sedation, and you almost always go straight home the exact same day. And when it comes to getting back to work, the data will blow your mind. 10 days. That's it. Studies show that 83.7% of patients are back at work with significantly improved function in 10 days or less after endoscopic lumbar surgery. Just imagine dealing with back pain for months, and then, boom, you're back on your feet a week and a half after the fix. Of course, that timeline scales depending on what you actually do for a living. If you work a desk job or do light work, the average return is an incredibly fast 7.5 days. Medium work bumps up to about 14 days. And even if your job involves heavy, demanding physical labor, you're looking at just over 3 weeks on average. Across all these studies, a staggering 92.5% of patients successfully get back to their jobs. And finally, Part 5, returning to active life. Getting back to the office is great, but what about the stuff you actually love doing? The hobbies, the sports? Well, the best available evidence shows that after traditional open surgery, getting back into the game takes anywhere from 5.2 to 8.7 months. That is a massive chunk of your year. But with the endoscopic approach, you're looking at just 1.5 to 2 months. You are literally shaving months off your recovery. And the success rate here is just phenomenal. More than 85% of patients who get endoscopic lumbar discectomies successfully return to athletics. We're talking dynamic, intense activities like golf, soccer, baseball, and heavy fitness training. Because, let's be real, the goal isn't just to stop the pain, right? It's to get your life back. So let's map out this whole journey based on the numbers. You go in, have the procedure, and you're out the door the very same day. In about 10 days, you're likely back at work. By 6 to 8 weeks, you're hitting the golf course or the field again. And by the 3-month mark, you're basically just dropping by the doctor's office for a routine post-op evaluation to confirm you're doing great. The physical footprint of this procedure is so incredibly small that it's earned a pretty catchy nickname in the medical field, because that tiny 8mm incision usually only needs a single stitch and a small antibacterial bandage. Doctors affectionately call it Band-Aid surgery. Seriously, no giant scars, no massive staples, none of that. The data we've looked at today paints a really clear picture. Minimal disruption, rapid healing. It completely shatters the old idea that spine surgery has to guarantee months of misery. Which leaves us with one vital question. If a tiny camera and an 8mm incision can fix the root cause of your pain in an outpatient setting, are you ready to reclaim your active lifestyle without the fear of a massive recovery?